That's wonderful. And what I like to emphasize, because I'm fascinated where technology is integrating itself within healthcare as we just continue to evolve collectively. But certain individuals have asked me, like, well, is critical thinking and soft skills a dying breed? Being the fact we are making these technological advances in the field. What is your perspective on that?
Well, I think critical thinking is probably a must, I would say. Now, some people recognize what they're doing, other people just do it naturally.
Hmm.
In healthcare, and I see a lot of this. It's easy to get pigeonholed if you don't work with other people and you just do the same procedures all the time. But the beauty is I work with residents and they have varied experiences, and you work with other physicians and surgeons who have a variety of experiences. And the beauty of healthcare is there's always something that you don't know beyond the scope
Yeah.
of what you typically would do in a day's work. And so there's just this infinite direction you could go with most areas of healthcare. And I love that. But I think for us, critical thinking is important because if you're not constantly trying to evaluate what you're doing and improve on that skill, you will fall behind. It won't take very long, but you'll be behind your colleagues. And you really owe it to your patients. I mean, when you sign up for this job,
Mhm.
what you finish learning in your training is not where it all stops.
Mhm.
You don't ever want to be one of those people that someone could tell when they train based on how they practice healthcare,
Yeah,
how they practice. Does that make sense? So
definitely.
people can be defined sometimes based on an era if they don't keep up with things and they're not constantly reevaluating what they're doing. So I think it's very important for people
Yeah.
to really kind of critically think about what you're doing.
Mhm.
And just being in my world, just being a great surgeon isn't always the right thing.
Mm.
Sometimes I have to stop and I have to think differently because I have to take into consideration what the patient really wants, what the family really wants, or what they need may be different.
Yeah,
And so we have to stop and say, okay, sometimes too much is not enough, or
that's
too much is too much.
true.
So we need to stop, shift gears, and think differently about how we're going to approach this problem.
Yeah, that's great.